Okay, well, thanks for everyone for coming back for day two. So on our panel here this morning for a bit of discussion, we have Darcy Fitzgerald, who is and I'm going to get this, executive director or general manager, executive director for Alberta Pork. Fair enough. And then we have Mike Honeycutt, the executive officer with the Montana Department of Livestock. Noel Ritson Bennett, who is the vet programs manager for Western Canada with CFIA, and Stephanie Smith, the chief veterinary officer for Saskatchewan. So our format this morning, we've got this split into two sessions. Our first one will run for about 45 minutes and a bit of exploring some of the issues that were identified yesterday, identifying whether there's some additional things to think about. And then our following session, we're going to do more of a general discussion of the whole group and try and come up with some solutions. So I've got some questions, but we're going to welcome them from the audience also. And yesterday we heard a number of challenges, some solutions also, but some of the challenges that I heard, one was around information overload. People already have so much information, but it's a matter of knowing what's important, what they should trust. A lot of information that's out there might not be factual. Sometimes challenges with timely information from what might be considered the right sources or from regulators or those who actually have the details that producers need to know. But then at the same time, when there is that communication, even if it's timely, it's not necessarily meeting producers where they are in the venues where they're actually gathering their information. And various comments around sort of that general loss of engagement related to a loss of in-person and not having that rapport to rely on when you actually have to communicate in a crisis. So I'm going to start just by asking, do you think there are additional issues or challenges that we haven't discussed, either that I just mentioned or that weren't brought up yesterday? Things you want to add to the table?
I think that's enough, isn't it? There's, I don't have anything else. Sorry.
Okay. Anything else? Well, good. Then yeah. Okay, well then maybe I will ask you in this issue of meeting producers where they are, communicating effectively so they can receive that information because they're not necessarily looking on a website. What do you think holds organizations back from communicating differently?
Me. It's difficult to do that. I think we certainly appreciate in CFIA that there's a lot of benefit to be able to, it's in person. COVID, as well as the recent avian influenza investigations throughout Western Canada have made it very difficult. So when we first started in AI, we were still in the midst of COVID. So we really did have to try to pivot and prevent a lot of interaction in person. But simply, it was mentioned yesterday, we've had ongoing investigations, in particular in the West, in all active investigations in all four provinces. So it's been a real struggle for us to just deliver geographically. But it definitely is something that we recognize there's value in. I think recently the other challenge that we've had is, quite frankly, just guaranteeing people's safety, which sounds a little alarmist, but it's a reality that we've had to deal with. I know we've had plans to attend some meetings, and where we've stepped away from them because there was concerns about individuals showing up at meetings and not having a friendly reception. And I think the CFI, certainly we've had some experiences recently that have really made us pause, I guess. We've had individuals. I have colleagues that have been impacted, been doxxed, been on Instagram. Their families have been impacted, children, schools. So while I appreciate that having in-person interactions are very valuable and very important, we as a industry, as a group, have some work to do, I think, to ensure that we can have those interactions. And that's not necessarily to say that on an individual level at a farm that you're going to be treated poorly, but certainly the notion of being in front of a room of unruly producers, as it were, and that's a challenge. And so I think, yeah, we have to think about how do we, it was mentioned yesterday that there's not a lack of information, but there's a lack of trust. And I think that that's something that we need to work on for sure to try to improve on those things, because the relationship in many instances is not collaborative. And I'm not pointing fingers. I think that we both have, when I say we both, like the two of us, or maybe just including the industry and governments, but mostly it's DFA, we have to recognize that we both exist because of each other. Um, Certainly in Canada, we're export driven, and having a competent authority that is effective and efficient and works and enables export is incredibly important. And I think we need to make sure that producers appreciate and understand that. And likewise, I think within CFIA and provincial governments, we need to recognize that, essentially we're there to ensure that industry is successful. Yeah, I'll stop talking. I think that's enough now.
Yeah, thanks.
I'll just reiterate. I think time and resources is the number one barrier, because, as you heard yesterday from industry leaders who are working with the private sector or working with, marketing and promotion programs, there's probably not enough of that we do in government to realize that, we should be trying to build ourselves in to operations as trusted partners, colleagues. I was thinking about that yesterday. I think we're very lucky in Montana with a lot of kudos to Dr. Szymanski and her team, and actually our whole department. Our meat inspection and our livestock brands, and we, the culture of it has been to sort of embed themselves with the industry and sort of almost be like another advisor, if you will, to operations. And so when things go wrong, that relationship's been built. And like I said, that's kudos to our team. I'm not patting myself on the back for that, for what they do. But the reason I say time and resources is because how they built that is very retail, very face to face. And all of you, everyone in this room, a lot of sacrifice. And I'll say that Dr. Szymanski makes a lot of sacrifice, and her team makes a lot of sacrifice, because we sort of have a mantra of wherever two or more are gathered in our name, we'll be there. So we don't say no to invitations, but that's a lot of Saturdays and Sundays, and like Montana, that's a lot of 12-hour driving trips for a 30-minute conversation in front of a group of producers. But if you only show up in crisis, that's where I think a lot of this happens. You got to have all those things have to be built ahead of time. But the challenge with that is, I mean, I can offer that advice, but that is time and resources. That's having the people, that's getting out there on the road, that's doing it, that's making sacrifices away from your personal life and your family. And it is really tough to maintain that type of vigilance. And quite honestly, there's only a few, like in the state of Montana, there's only a few of us to go around, in our department to cover a very, very large territory. And it's the same in Western Canada as well. And it's just very difficult to get that type of support and those types of sacrifices to get out there. So to me, that's the number one barrier. Is just we know what we need to do. Is just finding the time and the resources to do it is very difficult.
I can pipe in as well. Yeah, I think it's a very similar theme from the provincial government perspective. Holding back, when I think of specific examples, it's around the engagement piece of how does our system, our time, our process allow us to effectively engage to the producer level. And within that, I mean, currently we rely on the provincial association, right? We rely on that association having that voice, all the opinions, everything we need, which maybe isn't reasonable. So for me, when I'm thinking about kind of the system that we've built, CFIA, we rely on them to connect with the National Association. From the province, we rely on the Provincial Association. We do have FaceTime with producers, as was mentioned during some of those face-to-face events. But if this is how we engage and what we have doesn't give us, enough to get that correct opinion or to build that trust, then maybe we do need to think a little bit differently about how we commit to this and how we engage across the sector, and kind of rebuild some of that trust. And to me, there's two pieces to that rebuilding of trust about what holds us back. It's the people component. So as individuals, as employees, as public servants, we need to build that trust individually with the organizations, with the people, so that they want to come to us. Because if the only time, as you mentioned, Mike, if the only time I see people is when I'm placing a quarantine, they're probably not going to be that interested in what I have to say. So it is about me working within what I have, trying to build that connection. But then it is also about the system. Are there components within the system that can enable that better engagement, better communication? Because I think there are certainly those pieces, as was mentioned here, the time, the resources, the ability to be in person and try to drive trust that we have maybe lost based on efficiency, based on COVID, based on reallocation of resources.
So just before we go to you, Darcy, I wonder, Stephanie, from a provincial perspective, because I think most provinces have had the same shift away from extension. To what extent do you think that is part of that loss of rapport? Because I think in Alberta, certainly a lot of the times when we had people at producer meetings, and we would have people at every producer meeting, those were not necessarily those of us in the regulatory chair. It was people at other places in our ministry.
Yeah, well, and I have to speak from a position of being probably better off than some provinces, because we are one of the few that still has a publicly funded extension component within our Ministry of Agriculture, and that is kudos to the ministry recognizing the realities of producers and still being willing to fund that component, having those people, because 100% when we went through TB, those extension folks were in the room, and you could see where producers knew those people, knew their names, knew their faces, knew they were working with them on other things. Not just the disease issues, not just the emergencies. And 100% we rely on them to help us build those, because you're right, you can't be in every situation. But having them there, I think, definitely helps to bridge that gap between big, scary government and, what happens to the producer space. Yeah, absolutely.
Thanks. Go ahead.
Yeah, I was just going to say, I think it depends on the topic. And as we go through things, I'm pulling out this monster butcher block right now to knock on wood. I don't jinx anything, but without having a big crisis, it's just these day-to-day kind of grind issues. And so it might be a small disease issue. It might be something, a regulatory concern that's come up. I use zinc oxide as one for us. So we can't use zinc oxide, or it's going to be limited down. And why is that? Well, something happened in Europe. It's bad for the soil, and we find out, well, no, it's actually not. And actually, you could use it. You could use it as long as you prescribe where it's being used, instead of you can just use it. And I think there's remedies for all those things, but I think the words come out, and then everybody gets upset, and then you don't have the ability to, as an association or even government, because the response hasn't been fixed yet. You haven't quite got there yet between government and industry to actually come up with here's the solution we're headed towards. We can't really say that's going to be the solution until the solution is written on paper and said, yes, that it is. But producers are wanting you to have it right away. And the dubious part about being in Alberta is that, we have refundable levies. So if our producers don't like how fast our actions are, they can ask for their money back. But for us, it's more, we need to have the right facts. So to be trusted, you always have to have the right information. And if I can't say anything, if my response is always, well, I'm waiting yet, we're working on it. People don't like to hear we're still working on it. But I think those are the day-to-day trust, communication types of things. Again, time and resources, but also, do you have the right information? Have you worked with everybody to have that coordinated piece of information so that you're all saying the same thing at the same time? And then it is trusted, right? Because it's coming from multiple sources. And I think that's a key thing. And if I could just elaborate a little bit, I really think, and I use Alberta as just the example, I think we're in a very good position working with our provincial government. And Hussein's group as well, on a day-to-day basis. And then again, across Western Canada, we have an organization called Canada West Swine Health Intelligence Network. And so that brings in practitioners as well, gathering data, working with us, the CVOs, the pork associations from Western Canada. And we get a chance to meet and talk and look at what is the disease issues. There's you know, if you will, it's kind of like our smoke detector. You know, we're getting that information from practicing vets saying, here's what I'm seeing, here's what's going on, and are we seeing something coming up? And can we build on that? Can we build information? Can we get that out? And we do have a report that goes out to producers, whether they read it all the time. Sometimes it's maybe not that exciting and they don't, but it does get out to them, and it does get out to practicing vets. And then we also have an ongoing system that we are working with Hussein's staff as well, and with the department, to constantly monitor sites. So we've got that, and we can report back to producers about, you know, we're looking at the environmental situation. Is there an environmental positive? Are they mostly all negatives? But there they are. We've got this information, and we're constantly doing it. So again, it's another detection thing. And if we keep advertising and showing and putting that in front of producers and talk to them, but again, it comes down to that face-to-face often, that we're relying on that on a day-to-day grind just to be able to speak to producers. And we do have staff that's their job, is just to be out at the farm, boots on the ground, have those conversations. And I think if you can do more of that, kind of the day-to-day stuff, explain how things work, I think that when a crisis comes, maybe they'll be more prepared for it too.
And I would just add that the invitations are important. It really, you know, if we were invited to an AGM or something, even if it's for half an hour, to, you know, to give a few words, or just to shake some hands and interact with people, right? And it's much simpler for us to attend something when we're invited, and we don't have to pay for it, and then we don't have to get approvals.
November 19th.
You know what? You know, but for real, I mean, that's very real. Like,
More speaker, thanks. Yeah.
no.
I was going to add on something I heard Stephanie say about the, you know, that in sometimes with some of these provincial organizational meetings that somebody from your yeah, it's on. Somebody from your ministry is there, but not you. And maybe I'm uniquely positioned as the person sitting up here who holds what would be equivalent to a minister level position in Canada as an agency lead. And it's a barrier that I think people in my chairs often would not admit, but I'll say it today. A barrier is ego. And it's because now, luckily, I'm not an elected official, but I serve on the governor's cabinet. I serve at the pleasure of a board, and so there's that desire. One, from the organizations, they want to make that invitation to the highest person in the organization. There's an ego of the person that sits in my chair who wants to, you know, make that name and keep that out there. But the difficulty is then it doesn't allow everyone else in the organization to build the relationship. So, and I think Tahnee would back me up on this, that there's not an organization that I get invited to that I don't drag her and our brands administrator and everybody else in tow. And usually that presentation is me saying, hey, things are going great at Department of Livestock. Dr. Szymanski, what's happening with the animal health division? And I sit down and I let her present, and I let our brands administrator present. Or if there's an opportunity, we were just talking on the way up here, we have a TV show on PBS in Montana on Montana agriculture, and they want to do a show on our brand new veterinary diagnostic lab that we just opened up. And it's like, well, I could go be on TV for 30 minutes, but you know, Dr. Szymanski, that's in your division. You need to go be on that, or we need to get the lab director, Dr. Judah, on that show. And so that's a barrier I think people at my level have to admit, is that we're not helping our people if we're not promoting our people and we're not putting them out there, and we're actually not doing the industry any good, because odds are the majority of the questions they're going to ask me about animal health or disease response, I'm going to say, well, let me go talk to Dr. Szymanski and get back to you. And that doesn't really help anyone either, when I could have had someone there who could have absolutely answered the question in detail and told people exactly how things were going to work. So, so I think, you know, checking egos is really important too. And that happens between federal and state as well, right? Checking egos of we're all on the same team. And sometimes that becomes an issue as well.
Great. Thanks. So before I go to another question, just a note to the folks online that you are able to put your questions into the Whova app, and I've got it in front of me if you have any. I don't see any yet. And same to the people in the room. If you have specific questions you want to pitch to our panel, you're welcome to jump in.
Uh-oh.
Okay, there we go.
I'll let you start. Oh. I'm wondering about
Not on.
I'm wondering about maintenance of institutional knowledge. We know that people transit in and out of roles. We know that people change and that changes relationships behind the scenes. How can we do a better job of all of us? Like sometimes it's lessons we've learned from communication failures or engagement failures or in response failures, mistakes, whatever. In terms of maintaining and actually building on some of the lessons that we learn over time, because sometimes I feel like we always start over from scratch and it can be very frustrating from a point of view of any like producers that may have been through it before or people that have been involved before. How do we do a better job of kind of maintaining and passing along, building on what Mike had said about, you know, building up the other institutional capacity and knowledge?
I can take that one first. You're speaking my language, Karen. I could definitely speak to that as someone who is, you know, newer into government, been here since 2018, came into this role in 2020, and took over from a CVO that had been there for 8+ years. And so everything, the relationship she had, the things that she had built, the things that she had done, do not just transfer by saying, "Here's my emails. Go ahead and take a look what I did." And the biggest gap I have felt through that process is I could see over time, you know, with the building of relationships, with trust between her CFIA producer groups, etc. A lot of times they were working outside of scope. I think is what I've seen, right? Is everyone was willing to work in the gray area that may not have been totally what your role said you could do, but to benefit the situation because you trusted each other, you did it. So of course, when I come in as a new face, well, who's going to trust me, right? I'm not there to have that same level of confidentiality. I'm not here to have all those same pieces, and we all fall back on our mandates. So to me, the most important thing to change is the system, and whether that is simple things, you know, like building some better repositories of information that carry on, whether it is legislative change that allows collaboration to occur, information sharing to occur, whether it is Animal Health Canada, who's in the room today, holding on to that institutional knowledge that transitions between. I think there's a lot of importance in continuing that because it's all well and good as people for us to build trust with each other. And at some point, maybe I'll trust Noel. I'm not sure today, but it gets you somewhere. But that will not transition over. And I 100% agree. And especially when I see from the producer lens of like, what the hell? It was working well, and now it's not. And now you have further entrenched frustration in the system because the system never changed. It was people trying to make a difference. And then that makes it even harder for the next person coming in to say, well, I don't know how you did that because I'm not allowed to do that, right? So to me, it's system change has to come along with relationship building.
You know, the only thing I'd say is that I'm probably out on this question just because I sit in a very extremely lucky situation. So when I started at Department of Livestock 10 years ago, Dr. Marty Zalewski, who some people in the room probably know, was our state veterinarian, and Dr. Zalewski stayed with me for 8 years. And he left, and Dr. Szymanski come back from USDA, but she had been the assistant state vet before that for 10 years. Yeah, I don't know, maybe longer. And so for us, it's you know, we've been lucky, and you can look at our different divisions outside of animal health, and we have sort of a very similar structure. We tend to be able to turn and keep people moving up internally, and so we don't have people coming in from the outside. But what you have to do with that is that, you know, you also, as I'll go back to what I said before, you also have to send those people out in the world. They have to build relationships. Then you have to have a culture that retains them. And then you have to promote them. And so then you're in a position. I mean, right now, Dr. Szymanski has 3 very good veterinarians working underneath her. I'll mention for kudos, because I get lots of kudos from producers. Believe it or not, we have our DSA, or designated surveillance area for brucellosis, where producers are having to do or volunteering to do annual whole herd testing. They've been doing it for 20 years. They're very fatigued. The program's not going away anytime soon because the wildlife reservoir is not going away anytime soon. But I get lots of compliments on Dr. Brene Peterson, who works with that program. She goes down, she spends a lot of time in that part of the state, spends a lot of time with those producers, works with them very personally. And one day, if Dr. Peterson rises to the position of being our state veterinarian or our CVO at our state level, there'll already be those built-in relationships. And so I guess I would say I've been lucky. I've not had to experience that, but we've always had that sort of next person in line and those relationships built. But I also think that's part of our culture. From a management perspective, you have to build that in your culture. You have to promote people. And when I say promote people, not just promote them up the chain, but promote them out to the industry, get them out to the industry, get them in front of the industry so that when they assume those roles, it's just, it's Dr. Peterson now. Great. Or Dr. Kalizak now. Great. Okay. We know them and we've been working with them on other things. Great hire. And that's kind of what happened when Dr. Zalewski left and Dr. Szymanski come in. Everybody's like, great, Dr. Szymanski's back. Wonderful. Because those relationships were already built.
Onto that, I think another layer to that conversation is on the U.S. side. Mike mentioned brucellosis. It's something that we deal with on a daily basis in Montana. USDA at the national level has had some staff turnover in the last year and a half, and there is one person left at the national level who has any depth of knowledge about brucellosis. Like that knowledge base has been absolutely gutted. And the 3 GYA states, Idaho, Wyoming, and Montana have all seen enough turnover of staff. There's just a couple of us left. And that really is problematic, I think, to our industry to not have that depth of knowledge. And so I think one of the things that we really benefit from in the United States to help with that kind of knowledge retention is really close working relationships with our counterparts. I was talking to Teresa, I lost her here, but about she came down and attended Western States, which is a meeting of all of the Western state veterinarians. And it's an opportunity for us all to come together and exchange information. Within Montana, we meet with our USDA counterparts and our folks out in the field, and we recognize that everybody has knowledge to bring to the table. And so I think independent of the interaction from kind of government to the producer level, making sure that there's really strong relationships within whatever circle you operate in so that they can help with that information retention. We work really hard to get others answers to brucellosis questions. North Dakota is dealing with an elk with a non-negative result, and they all reached out to us to help with that because nobody in North Dakota has any depth of knowledge about brucellosis anymore. So knowing where your resources are, unfortunately, all 50 state veterinarians don't turn over at the same time.
I'm glad that Stephanie said Animal Health Canada, because I think that the relationships are important. But you can see, I think we're still in a COVID hangover here, where those relationships, those interactions disappeared for a period of years, and now we're trying to put them back together. And there was some turnover, and you can see, TB, for example, people weren't familiar with each other necessarily or what to do and how to do things. And, we're back at sort of square one. But I think if you're intentional and you utilize an organization like Animal Health Canada, for example, to be the keeper, as it were, and to of some of that information, I think there's a lot of opportunity there for us to build upon that capacity that it won't just disappear when one person's not there. You can't respond to that, sorry.
No, you already committed me, Noel. It's okay. We've been thinking a lot about lessons learning in Animal Health Canada recently. It's on our docket to sort of come up with a system within our governance structure to help support that this year. But one thing that I have been noticing is when things get tight, organizations get short-staffed, people move into survival mode, lessons learned is low on the priority list. And it actually needs to be higher on the priority list during those times. And it's almost like an organizational cultural shift that needs to be really fought for, because those are the times when it's the highest risk to lose information. But it's also the time when there's the least amount of bandwidth to do it. So Animal Health Canada does exist largely to help support the members around the table with things like this, because I do think it is reasonable for organizations to say, hey, we're putting out fires right now. We can't support doing that internally, but then there's a commitment that needs to be, we can actually help communicate better with each other to ensure that it does land with somebody else. And that rolls back into that trust piece and that commitment piece as well. But yeah, it is an important thing.
And Mike said it, time and money. And others have heard me say this before, but I'll say it again. Animal Health Australia is a $14-15 million a year budget. Half of that comes from government, half of it comes from industry. I don't know what Animal Health Canada's budget is, but it's not that high. I don't know if there's an equivalent in the States, but the point being is that there is a commitment from government, provincial, or in Australia, the state government and federal government and industry, and it's a shared responsibility to make sure that it works.
If I could too, I think if you looked at some of the issues, and we talk about it all the time, and on the industry side is, I'll just use ASF. ASF hits, you got a farm, CFIA, that's your job. Although we have the burden of the mental health issues, you get to come in and do what you want to do. But the bigger crisis for us is what's happening outside that farm. And that's not your concern anymore. Like, you're not worried about that per se. You're worried about, how things are written down black and white and what goes on the farm and how you're going to deal with that right specific spot. But meanwhile, outside is 99.9% of the industry not knowing what to do and how do we do that. And I think that crisis mode part, there's been quite a few good examples of that. But the problem sometimes, it takes too long. Like you said, it takes too long to come back. And if I think of 2010, the old mill plant in Red Deer, one day I get a phone call and one of my colleagues phones me up and says, Old mill's done, they're shutting down. And my first response to that, we're doing, it's not as big as some US plants, but we're doing 9,000 pigs a week. And they say they're shut down. How am I going to deal with 9,000 pigs? And my only thought in that was that they were moving back to Quebec and they were selling. They were getting out of this business out of Alberta. But it wasn't that. They got shut down by CFIA. As it probably turns out, they never tested it, but maybe it was Seneca Valley virus or something. They thought it was foot and mouth. 3 days it was shut down. Everybody was in panic mode. What do we do? And that lesson learned a year later to sit down and have that conversation. I'm really not sure the lesson learned is being carried over today. And that lesson learned is you've got to allow the pigs that are out there that have a day-to-day grind or drive into that plant. They still have to keep going there. There's no place for them to go. So they have to keep going into that plant. The plant will look after whatever happens. You can shut the plant down, but the pigs still have to be processed. They're on the road and they have to go somewhere. So that to me would be a lesson learned. Like, we found that we don't have those places for the pigs to go anymore. So if there's 8,500 pigs still on the road in those trucks, your alternative is the truck driver just opening the door and letting them go, because he's got to do something with them, and he's got no place to go. And so if they just continue to go to the plant, you can shut the plant down, everything processes, goes through. Your only fear in CFIA, I would think, in government is who's going to pay for those pigs. But the plant has to say, well, we'll just let them go through, because that's the only way we can get them off the road and look after them. But it's those little things of lesson learned that should be caught really quickly and then talked about. Here we are 16 years later. I think the response might still be the same. Sorry, you can't come to the plant. And then what do we do with them? We have no place to go. So there are things like that we just need to get on to quickly and understand.
Okay. Go ahead.
Who gave you a mic, Miles? You brought your own phone.
Could stand up and use, the dad voice, but Glenn Dyser, Chief Veterinary Officer from Manitoba. And so I think we kind of have fell into this, but a couple things that Mike said, Stephanie said, and Darcy said that I wanted to touch on. We talked a lot about, and yesterday we heard about building those networks to connect with producers. So I'm bringing us back to the producer level. And as I was thinking about this and we were talking about it this morning, I took a quick look at my phone and just looked at what phone calls I had either made or had received in the last couple of days while I was here. And just wanted, especially maybe Mike and Tahnee from Montana, when you and fully agree in that peacetime, finding the resources to make all those connections. What level of connection do you do to build that network around the producer? Darcy hit on this a little bit when we talked about Quishin and having the veterinarians involved. When I look at my phone, I've got a phone call from an assembly yard operator manager. I got a phone call from a poultry procurement manager for a packing plant. And that's because they have my number and we're on a first name basis. And that we built that. So those are just two examples. We have those contacts into transport, into production management, into the veterinary field as well. Is that been helpful? Have you done that? And has it been helpful to build that, expand the network, not just about going to that producer meeting, but being able to know who that transporter is, who those producers are talking to? Because to me, I think that's a way that we can build that trust, because they're not just hearing it from us. That procurement guy from the poultry plant trusted me enough to be able to feed me back information about a potential flock for a vaccine trial. And that's very valuable for us to move forward on a potential vaccine trial that we're considering on. So just was wondering if you've tried to expand that network and build that even further to build the trust, really build that trust network around the producer.
Yeah, and I'll say again, it's our structure in Montana really other states in that, the Department of Livestock, the greater Department of Livestock, our livestock brands is handled. We're responsible for dealer licensing and oversight, market licensing and oversight. So Dr. Szymanski has colleagues that she can plug in if she doesn't have those relationships for transport, sale. Local inspectors who are, in Montana, we still have, and I think everyone should have this, but that's just my opinion, because namely not for livestock theft as it was intended, but actually for animal disease traceability, we require inspection of all livestock moving across county lines. And so we have a network of 500 local inspectors around the state that we can plug into, that we can send information to. So again, some of that's our structure. Allows for that. And as you said, those relationships around the producer, we have very embedded there. And I'll actually give an example that I actually saw Dr. Szymanski handle as we were riding back from an event just this past Friday, that one of our local inspectors who had been asked to go out and inspect horses, and Dr. Szymanski didn't know who they were, but the name popped up on her phone. And she's like, well, their name's in my phone. I must know who this is. So she answers the phone. It's one of our 500 local inspectors in the state that she had talked to about an issue 5-6 years ago, and that's why it was in her phone. But he was calling her because he had shown up, and this lady had some horses she wanted to move that had an issue with pigeon fever, and he wanted to make sure before he wrote a movement inspection for those horses that she wasn't in violation of any animal health regulations or anything else she needed to do. Just like to your example about reporting the flock. And so those relationships help because one, they report, they have that feeling of they're part of us and they report that to us, but they're also people that we can go out through to connect to the producers and be if we don't have a trusted voice in that community, maybe they have a trusted voice in that community, or they have a trusted voice in that segment of the industry. So it's beyond just the organizations, but I can't claim or say, what are we doing right? Except, Montana in that case of that is that the unique structure of our department allows for the way we work with the industry to be plugged in all around it and then leverage that for animal health. And sometimes we're leveraging animal health for other areas of the department. We're sharing those relationships and sharing those connections to the benefit of what the work we're trying to do, but also to the benefit of our producers and get it right. I don't know if you would add anything to that, Tahnee.
Yeah, I think maybe just to try and be brief, I think I don't know what your provincial veterinarians, what your engagement is with your veterinary workforce, like your local veterinarians, but we work really hard to cultivate those relationships. And so if they're trusted in the community, they will help kind of carry your message forward. I think one of the other things that maybe we have not done so much deliberately, but that we've fallen into is that we're a tremendously small bureau. So the Animal Health Division is, I think, a total of 11 employees for the state of Montana. And so we obviously can't do everything all of the time. And so we've had to cultivate a lot of relationships We work with our Fish, Wildlife and Parks Agency, our public health, disaster emergency services, and all of those groups have locals in the different communities. And so having that level of familiarity where, maybe they don't have a veterinarian that they work with, or they don't trust the messaging that comes from us. But if there's somebody else out in the community that can vouch for us, it goes a long way. And I think that I'll say that the swine industry, and maybe it's because it's our smaller industry, I don't believe that that's the true reason. Our swine industry in Montana is a lot easier to accomplish that with. They have veterinarians that are very active in the industry. They have a producer organization that's very active. The hog producers themselves are very interactive. They're knowledgeable about disease. Like, they're so easy to work with. I think the size and diversity of our beef industry, not that they're not intelligent and engaged, but just the size and diversity of it makes it a lot more challenging.
I'm glad you brought us back to that, Glenn, because 100% the working on building relationships outside of just the producer is 100% important. And we certainly have seen that in the last several outbreak issues. Trigger warning, I'm going to say the O word, in the ostrich situation. Look at how our own veterinary community, who should be aware of the science, who should be aware of where things sit and why we do what we do, were themselves questioning, putting stuff on social media, asking each other, even themselves, bashing CFIA, bashing everything else because they didn't understand the policy. And those should be the people that understood, the scientific perspective the most, and yet they didn't. And whether that was because of, gapping information, disbelief, distrust, listening to, the frustration of their own clients, things like that, or just listening to the social media pressure, they weren't necessarily coming back to the right source to find out what was the true information before continuing that misinformation online. So it is very critical to me that it's not just the producer. You have to go to everybody and kind of back to that message of you need that consistent approach. We need to be talking from the same playlist, talking from the same songbook if we're going to be trying to build that trust, because if they're getting mixed messaging across the board, it doesn't help us. And I even saw that with a recent One Health meeting we had on the human side. I saw this very clearly when we talked about high path AI, and we had some medical device sales folks in the room, and they were talking about how they felt about high path AI policies and some of the information they were sharing to, private doctor clinics and things like that was completely uninformed, that didn't make sense, that wasn't accurate. But yet they were a trusted voice. They were in the room with practitioners, and that was helping to spread information that was not true of what the policy was at the time. So it is trying to work with them. Personally, yes, I've tried to build some of those. I think I need to do more, absolutely. And I did see the benefit of that through TB for sure. We have the relationship through our Veterinary Medical Association. I've got a lot of my large animal practitioners on those calls, and we can have honest conversations about what's happening. And back to the question that I'd asked yesterday at end of day on how aware are people of government policy and process, I don't think they're aware at all. And I do see that as a real need from our side, is to get out there and help people understand, because they don't understand, and we're not doing a good enough job to talk about what is actually happening. What is that process? What is the decision making? Why is the decision that we make, it's not just science-based. There is many other policies that come into play, but we're not doing a good enough job talking about that process. So it makes sense that people don't trust, and then they fill in the narrative what makes sense.
I can yell it.
Go online because there's online people to listen.
Oh yeah, thanks. Just to add on to the veterinary piece, I don't necessarily need them to understand the policy and the regulations and all of that to go along with it, but I need them to trust me enough to call me or call my team, right? If I can get them to do that, I don't expect them to know the multiple different regulations or policies on our side or on the federal side. But if they trust me enough to call me, then our team will help them sort it out.
Could I say that would go as well with, say, I just use ASF as a good example. Like, if the tent is big enough, and I think we're trying across provinces, we have conversations with our colleagues in the US about what we're trying to do as well. But if I look at our region, when the tent's a little bit bigger, and we have, we're working in each province with our provincial governments, trying to make sure we have plans and prevention and things that we're doing. And I think we're doing a really good job. I mean, we have gaps yet, things we need to work on. Communications is probably a good one. We need to work on even more. But, you know, some of those things about laying out, here's the plan, and then we look at it from a regional perspective. The tent's a little bit bigger. Now we've got the 4 governments for us, the provinces, plus we've also got the 4 associations. And we're looking at, okay, what's our emergency plan? What are we going to do? How do we work together? What are you going to do? Because we're integrated. We actually move pigs back and forth. We pass each other on the highway with loads of pigs, waving at each other, going back and forth to each province. And you know, at some point in time, we have to recognize that our plan pretty much has to be the same. And we really need to deal with it similarly. And then again, that brings in the vets, it brings in trucking, it brings in landfill, it brings in all this stuff that we have to deal with. But I think that's the key part, though, about even retaining that knowledge, about having something written down so we understand. So if someone leaves, that was one person out of like a huge team of people that still have that knowledge and continue it on, and that continuous meeting, like once a year even, you know, sit down. How's the plan? Who's involved? What's there? And I think if we could do more of that, like some of those bigger crisis issues that we think we're going to face, you know, they're kind of, we've got something really solid to sit on, and we know who's going to have what role, what action, you know, what's going to happen. I feel confident. It's up to us as associations to give that back to producers and tell them, here's what we've done, walk them through, sit down in small meetings and say, here's what to expect. And I think we're trying to do that. I think we just need to fill in some of the gaps, though, so that people feel a little more confident about it. And then, I mean, the vet in our industry is a team player. That's no different than anybody else. They are a critical part. The truck driver is a critical part. The feed guy is a critical part. Everybody needs to talk to each other and understand the plan and what's going on. And so, like, to your point, Glenn, I don't think people need to know all the nuts and bolts of a regulation, but they need to know why that's there. Like, they need to know why we're going to enact something, why that policy is in place, and why we're going to do things the way we're going to do them. And I think the more we can spread that, the better.
Okay, so I know, I'll let Neil jump in for a second. I do want to say we want to transition to our next section because we only have another 35, 40 minutes this morning to talk about solutions and not just problems. Yeah, so I'll let Miles go quick and then we will try and transition.
So do I get to?
Okay.
The one thing I would just add there, and I think the interactions with people like you're talking about, Glenn, are within the industry. I think that we need to come to grips, not only as governments, but as industry, about social media and how we communicate some of those things, and our willingness to interact in that space, and be proactive and have a consistent message within, you know, between governments and industry. I think that the O word, you know, that in that situation, I think there's a lot of examples about how we were less proactive perhaps than we needed to be. But I would put it out back to industry. Again, going back to the idea that we are an exporting nation, that we are dependent on a regulatory system that exists. And I don't think there is any industry out there that publicly stood up and said that this is an important thing to support. And I think that again, we own some of that as well. You know, had impacts on just the overall public perception, and I would dare say had implications on traceability, for example, moving, you know, after the fact.
Hello. Oh, there we go. So just back to the TB issue. So as far as producers, I'm an hour and a half east of here. So there were some producers in our area affected by TB, but Saskatchewan and Alberta and right through. So, you know, I know that you're, you know, strained as far as money is concerned and stuff, but often the CFIA will come to a producer's place without the local veterinarian that the local, you know, that the people have a relationship with, and they tell them how things are going to go. And then, you know, it's affecting their livelihood, it's affecting their lives and their kids and their relationship with community. And then the quarantines are going on, and that's, you know, everybody knows that, but they're unable to get paid for the amount of time they're feeding these animals. They're unable to move any animals. It becomes a bank issue, a financial issue. And that's one thing that the CFIA doesn't take into account, that there's more than just the disease trace out. There's more than following these things up. There's a full community, and there's these producers to be aware of. So, you know, we've pretty much, we've tried to, work with them some and say, listen, maybe you need to have legal counsel with you if the CFIA comes on your place to talk to you about these things. And it's unfortunate that the relationship has gotten this way. But there used to be a federal vet all over. Like there was one in Vermilion. There was a lot of these federal vets around that the community knew. And if there was an issue, these guys could come onto your place and say, hey, sorry, this is what's going to happen, and we're going to do our best to accommodate you and be okay. But it's not the relationship that's happened, and then these communities hear about that, and then it gets passed around, and whether it's the right story, the true story, or who knows, but and everybody adds a little bit. So I'm just bringing that forward. That I know it's tough. It's a tough situation. It's tough for producers. It's tough for the communities.
So I'm going to speak. I know that wasn't a question, Miles. You never have a question. It's always a statement. So even Americans can recognize that and have a segment. But I'm gonna take it as when you, yeah. So, but no, I was going to speak to that just a little bit, and I can't speak to what happened up here in Canada with TB. I was watching it from across the border, but. You talk about lessons learned in our department, and this will tie in a little bit to you talk about institutional knowledge. We do strive to build sort of shared language and culture. I think that's big in the management side. I know Dr. Szymanski, I don't always do my best job to say, she gets to work on the science and the reg book, and I get to work on the politics. I don't do a good job of keeping politics out of her office all the time, but we sit down and we consider those things. And so just things to consider as you're thinking about it, and things I think have worked for us in building trust with our producers and having some valued people is, beyond going out and having the public meeting at the head of some sort of outbreak or situation and talking to the producers in that community about what's coming. The other shared language is about right-sizing the response, right-sizing the regulation in accordance with the risk. So because honestly, and I think that's what you're talking about, Miles, is that if the cure to the disease kills the patient, which in this case, the patient's the industry, then it's not a good cure. We need a different cure. But, I think we strive not just in animal health, but across all of our regulatory to try to figure out how do we manage the risk in the least intrusive way possible. So if there's a situation and we've got to place a quarantine, but we can judge that the risk is not so great that we can allow that producer to go to grass because it's 2 weeks from going to grass. We're not going to get them tested. We could make them stay home. We could make them go buy hay. We could make them feed. But if we can make that decision, say, here's what we're going to do. You're going to go to grass. We don't think it's a heightened risk to wildlife or other livestock. If we can make that assessment, we're going to let you go. And then we're going to test you when you come back. But we're going to be coming back when you come home. And then we'll do our test and we'll get everything cleared. You're still under quarantine during all that time, but at least you're able to keep some semblance of your operation in place. And the more of that you can do, that builds goodwill, that spreads around. And then the next time when a producer, like in the brucellosis world, says, well, if I get a positive, they're going to come kill my whole herd. And we have producers now be like, man, you're thinking 1960. That's not what they do. That's not what they're going to do. They're going to come and place a quarantine. They're going to get through it as fast as they can. They're going to try to get you back to operation. Kudos to Dr. Szymanski, because I'll say she's working right now. And that's the other thing. Producers need to see folks in these positions going to bat for them. She's fighting back or pushing back a little bit against the Forest Service down in our brucellosis designated surveillance area because we already have brucellosis in the elk, right? It's already there. We're not going to spread brucellosis to wildlife if we have a quarantine herd go on a Forest Service lease, but the Forest Service denies quarantine animals going on leases. But she's fighting to say, hey, we would help these producers a lot during a quarantine if we could let them get to their Forest Service lease, and then they're not at home having to pay for additional hay and feeding for that 5-6 months as we're working through that situation to get them to a whole herd negative test, get them cleared, and get them out of quarantine. So the more of those things that you can think about, there's always the 100% answer, or there might be the way the book says it, but you just have to think about how do you right size that response to what the risk is and help that producer as much as you can while maintaining the integrity of what you're trying to do. And again, I'm going to say kudos to Dr. Szymanski. Her team does a great job of doing that. And they also know when they come to my office as the Politico, that's going to be the question I'm going to ask is like, all right, how do we get through this without in the least intrusive way possible, without damaging the industry, without putting people out of business? Because those are the questions I'm going to get from the governor's office and the legislature and the people I have to go support what we're doing too. So that's my statement, Miles. There you go.
Okay,
And can I
I'm just going to pause this for a sec, and correct me if I'm wrong, Tahnee, but I think our intent was to let these folks go and move this to a sort of a room
Yes.
discussion.
Yes.
Yes. So
Can I?
it's up to you whether you want to make a comment.
Give me 1 minute. I need a statement too for Miles. and then that gets Noel off the hot seat. I think two things I'll say on TB. One, to your point, Mike, response plans, right? Is we also want that opportunity to sit together and understand because, thinking about the history of TB, where we used to be and how CFI did adjust policy based on feedback from industry, that did happen. How many of us in the room here today were there for that point in time? I would wager probably almost none, maybe none. So I think it's almost that same thing that we're talking about with traceability, where decisions were made, conversations were had, there was an understanding. Nobody remembered that. So I think that is one key part of this. We've done some of that along the way, but realistically, in a response, it is hard as hell to get everyone in a room to have that conversation when you're just trying to respond. And that is not an easy time to make policy change. We do know, based on some of those conversations, there have been allowances. There has been consideration of what's reasonable, what can we do. Is there more of that? I 100% think so. And I hope that Noel's willing to have that conversation and his policy people. But that is a conversation to have together, right? Because at the end of the day, what we don't want is government sitting alone in isolation doing this and then saying, hey guys, yeah, it's all good. Because I know 100% no one's going to believe that. So we want to be in a room together. And I think the same holds true for the financial piece. I agree that there are gaps here depending on our goal of what financial support looks like, right? And what is the goal of it? And the existing systems 100% have gaps. If you are looking at something that incentivizes compliance, that isn't what we have. There are cross-border realities of that too, if I understand, around agri assurance programs. So I think there are complexities there that I don't fully know, but I'd like to understand and figure out how does this look? So I think there is that room for cross-border communication on how do we make sure that our producers are getting what they need so that we get what we need, which is a disease-free country or disease-controlled, whatever that is, and go down that approach. But it takes those conversations to be had by all, right? Not just by government, but also industry at the table.
Say, can I just one little quick
So sure.
tidbit. Just going back to that question though, it comes down to if was there ever a practice run? Because if there was a practice run and people actually came out to just pick a ranch and it's a practice run, I'm sure the rancher would have had a lot of questions. Like, okay, here's what's going on. Here's what I'm gonna feel. And the emotions aren't like at a peak height. They're at, okay, well, we're just pretending right now, so I can just ask you these questions. But you're gonna walk through the thing because I've noticed that too, like with our staff actually training government staff as well, going out. Let's go to a farm. Let's walk through. Like, how do we get the samples? How do you work at the barn? How do you do stuff? Because not everybody has experience actually being at a farm. You may have a role to do, but you may not actually go out to farms that often to actually do these things. And so it's good to maybe get out there and run through the scenario about what you're going to do and invite an association with you, invite that practicing vet, have some other people there that they can ask the tough questions. And then everybody's at least understanding, oh, okay, well, if this ever happens, here's the barrage of things I've got to deal with. Rather than it's minus 30 and you got, I'm going to say CFIA staff trying to change out of their clothes outside of a vehicle in a snowbank. That's not going to be a good thing. So I mean, that's just the simple thing about, okay, well, how do we get stuff set up? Are you there? Can we do things? What's going on? What's the farmer going to say? Because we've actually had a producer who lived through like a horrendous situation a number of years ago. And it was public staff that came in and tried to help out to cull animals. And if you have to try to cull sows inside a barn and haul them out, and you don't do it for a living, I mean, some of those people were going to counseling for like 10, 15 years later. They were traumatized, let alone the producer. So, I mean, having a little practice might be good too, just to see what the problems could be.
Yeah. Well, thanks very much to our panel. We're going to let you go. So round of applause for them. Okay, so I'm going to pass the lead to Tahnee, but this next little bit, and we've got just a little under half an hour to have a bit of a
Get
group
pretty-
discussion.
little bit on-
And again, the intention here is to focus on solution. So maybe I'm going to actually point to Karen to maybe speak just on this theme of TB, because I know you've been around for a few outbreaks. Maybe one or two of the things you've observed that you think have led to improved communication, have smoothed up over some of the challenges that have been identified. So over to you, Tahnee.
We're going to start with a question.
Or a statement. Okay. So I don't want you guys to feel like I'm beating a dead horse here, but we've got a really good minds around the table here. And when it comes to this misinformation stuff, I think there's a nuance here for me that I'd like to question you guys on. And that's whether or not, like, we've identified lack of trust as an issue in this space. But I guess my question for you is that the actual syndrome, or is that still part of a symptom? Because if we look to seal up a symptom, the syndrome's still there at the base of it. And so as we move forward to look into solution zone, I guess that's my question for you guys is that the whole story, or is there more there contributing to that we need to consider?
That is a great question. Thank you. We don't really have I don't know where to go, so we're going to walk and talk with me. I think that I'm going to put a pin in that for just 1 second, and then give me a minute to set the stage here. I think that we have 2 sessions left. We have this short one now, and then we've got one after the break before we conclude for this meeting. And I think one of the things that we've struggled with the cross-border livestock health group is really where is the cross-border component, which is what is going to be the second component. This one is trying to kind of put a bow on the package of everything that we've done leading up to now. And I think that when you think of all of the diversity of information that was presented to us yesterday, there's so many pieces there. And I think a lot of our discussion has really been down kind of in the nuts and bolts of specific scenarios, traceability, tuberculosis, those darn birds. In my world, bison is the bad word, and you get ostrich is the bad word. So if you ever want to swap, let me know.
Okay, we'll swap.
But listening to your experience, I'm so sorry that you have instances where you've gone out and you don't feel like you're safe going into an environment. I've certainly stood in front of a room of hostile people, but I've never worried about my safety while I had angry people in front of me. And so I think that very much speaks to the heart of your question is I think there's something deeper here that we need to maybe be thinking about. And so if anybody wants to volunteer an answer to the question, I would love to hear it. But I do think that there are maybe bigger social systemic issues that we're caught in, regardless of whether we want to be there or not. And maybe it's not our job to solve them, but how do we work within them?
Yeah, I agree. We cannot solve it all within our control, but I do think we need to try within our spaces, because if we simply pass the buck and say, this isn't my problem, I don't think we're going to get anywhere. So for me, one of the things I was going to comment on the panel was around, I think it is the diversity piece that maybe our systems don't recognize. So I think it is some systemic issues in terms of the general public not seeing themselves reflected within their government, not seeing themselves reflected within their industry association, and all of the systems that we have built, because we have many diverse opinions, diverse backgrounds, and in this day and age, diverse opinions of science, right? So if our existing systems propose that they speak for the majority, I think that is not a good place to start. And in my mind, that is hand in hand with trust. But it is something that I hope from the regulatory perspective we are thinking about is what we do today may not work in the future. Can we change today at a provincial level? Not necessarily. Can CFIA change? Not necessarily, because we have built a global system of how we approach animal disease and trade. But if this does not easily reflect the majority, if this ends up resulting in producer compliance, then how much further ahead are we if we're not being willing to innovate, think outside the box, and look at that systemic level?
I think one of the benefits that we have in the United States is I think the states have a little bit more authority in some of those disease investigations that allow us to be a little bit more mobile. Mike and I had this conversation on the drive up, like the 2 realms that we try to work within are within science and within the law. And I know that in my bad word category, one of the things that we struggle with is that the science moves faster than the law can keep up with. And so how do you operate within the parameters of science with that laws don't reflect that science? And it's hard to get things changed, especially at the national level. And so are those initiatives that we should be talking about? Like, are there restructuring? Are there changes in laws? Are there thinning out of laws so that there does give more maybe leeway in how those responses look? I'm guessing that for CFIA and tuberculosis, it's pretty prescriptive on what has to be done. And we had a lot of leeway to say, yep, you're under quarantine, you're not under quarantine, we'll catch you in the fall. Early on in my career, I killed 18 baby calves TB testing at branding, and I will never do that again. They mother up the first time, they don't mother up the second time. That was a very hard lesson. And I still, like 10 years later, when I talk to that producer, he chews me out for the first 2 minutes of the conversation. Like, he will never forget it either. So like, those are painful lessons to learn, but I learned from it. And in my position, I'm fortunate to have the autonomy to make different decisions. So I don't know that your structure maybe is the same.
I think for one of the opportunities we have as regulators, low-hanging fruit, if you will, is to make sure maybe change our culture. Maybe it's not low-hanging fruit. I think it is. Change our culture a little bit, in that we understand the science and we understand the law, to your point, and we come on and we know the checklist of what we need to do in order to get that contained, to get it under quarantine, to do the trace outs from it. What I think we forget is the person that's in front of us when we're having that conversation is not broken the law, hasn't done anything wrong that we know of yet. Maybe we can look at their behavior and say, that's kind of risky. But if it's within the parameters of their industry or what their neighbors do, they haven't really done anything wrong. They're a victim. They've had something happen to them. And this is brand new to them. And I think if we can change our mindset a little bit to remember that, to say, it's almost a harm reduction strategy as opposed to a full-on regulatory strategy. That is a small thing, I think, that we can try to implement to perhaps improve the relationships a little bit.
Yes.
That's a great comment.
Just a quick comment. As a legislator, I think quite often we are predisposed to prescriptive regulations and prescriptive legislation. So something I would ask of all of you in your respective jurisdictions, when you're experts in your field and you're consulted by legislators on how to write regulations and how to write legislation, push hard at objective legislation as opposed to prescriptive. So that gives you the latitude then to maintain your reputation, because that then, to speak to the reputation part, reputations aren't built overnight or not with a magic wand, right? And that is the only thing that you have in the face of that producer when you're on site, is your reputation as an individual or as an organization to instill trust in that person that you're doing the right thing. Your reputation can be gone in the flash of an eye, and it takes a lifetime to build up. So you absolutely have to defend it as much as you possibly can, and always do the right thing. All right, thank you.
Thank you for that comment. Anybody else want to? Oh.
I think in a lot of cases, it's about the why. And we don't necessarily do enough to explain the why. There's a really good example, and Hussein asked me a little bit about what I've learned through a couple of TB investigations now, but we put out an information piece, worked with CFIA on it, worked to put it in plain language. I shared it with some folks in a previous investigation, and they said, we wish we would have had that. This tells us the why. This tells us what we can expect and why this would happen. And I think that was one thing that we should have done after 2016 right off the hop instead of waiting for 2024 to get it done. I think there are definitely, I've seen CFIA be very flexible in dealing with producers if they can be in the scope of disease control activities, right? Because that's what we're doing. We're controlling disease. Commiserate with risk, like Mike said. I have seen them bring industry in much closer than we have been in the past and earlier than we have been in the past. And I think that's helped. They've been trying to do, I wouldn't necessarily call it face-to-face, but the case officer model was kind of designed to provide producers with a trusted information piece. It doesn't always work quite the way we hope it will, but that has been an evolution as well. So I think we do learn things, but we need to do a better job of explaining the why.
Are you going to answer your own question? No, I wanted you to.
No, it's just something I'm considering, and you actually touched on it, Tahnee, the socioeconomic piece to this. And none of us around the table that I know of are psychologists, but I think there is something to be said about the climate we're living in. And in Canada, we've been really blessed for many, many decades to actually have fairly stable trading partners, systems. Everything's shifted, and I'm not sure everyone really cognizantly recognizes what that does to the people around the table, because we're being impacted differently. And I think there are a wide range of producers that had a perspective on life that was controlling their behaviors and influencing their behaviors that has now shifted significantly. You had people that had hopes and dreams and goals and legacies, and now they're running too tight against margins. And you're starting to deal with things like defeat and hopelessness. And that really shifts the way people have the ability to engage with each other with grace and compassion and understanding. And yesterday, in that talk from Dr. Chaudhry, he talked about how empathy was really key to developing trust. And sometimes I wonder if the people who aren't running that margin line quite so quickly, haven't been impacted yet, don't recognize that other people have less. And so it's easy to bend for situations that you need to when you have the money, when you have the hope that you can recover. But nobody goes down without a fight if they feel like they're not going to recover. And so those aspects of humanity, I think, if we spent some time thinking about what we're actually engaging with, might give us a little bit more success when we try to predict how people are going to respond with our engagement moving forward. And so there really is a humanity piece to this that I think has shifted, and none of us around the table have had to deal with the complexity of that before. And that's really part of what we're dealing with as a tangible problem here.
I think that's a great comment. We talk about, again, brucellosis is my wheelhouse, so I can do this one all day. Where our DSA is located is some beautiful country in Montana. A lot of our ranches are absentee owners. So the ranch is maybe more in the hobby category of a family farm. In our history of our affected herds, we had one that was their day job. They didn't work off the farm. There wasn't an absentee owner, and they were always dubbed the problematic positive herd. And I don't think that they were the problematic positive herd. They were the ones that had the most on the line. And like you said, they perceived like going down in business. And so they were fighting for what they needed. And they unfortunately ran in an area where they circled back around and did it a second time with brucellosis. And the second go round, we tried to come at them with a lot more empathy. And we approached them very differently. And now we have really strong working relationships with those individuals because I think we changed our perspective or our lens of how we looked at them. Any other questions, or anybody want to make a comment? We have about 9 minutes left. I have a question for maybe the industry folk here. What do you need? I mean, we talked about it a little bit, the why. But when we do get fortunate enough to get the invitation to come and stand in front of your group and talk with you, what do you want us to bring to you? Because when I first stepped into the state veterinarian role and I would go out to producer meetings, I would kind of have my list of talking points, and I would hit like high level things, assuming that there was like a foundational knowledge about some of the components of what response to brucellosis or response to New World screwworm or avian influenza was. And after a couple of rounds of that, as some of my nerves worked out of the system, I was like, these people don't have a clue what I'm talking about. And so I've really started to restructure how I come in front of those groups. And I do a lot of more like what I would call entry level information to build that. Is that what you want from your regulators? Is there somebody else that we need to introduce into the system that they can be doing some of that foundational knowledge? And it's not everybody. I don't want to infer that it's everybody, but there are some folks out there that if brucellosis has never touched you, like you just don't know. If tuberculosis hasn't been present in the state of Montana for 50 years, when all of a sudden we have a tuberculosis trace, like you really have to build from the ground up. And I think sometimes we as regulators, because we live it and breathe it every single day, we talk at the wrong level. So if anybody from industry has comments on like what we should be bringing to those meetings.
Yeah, I think you nailed it well there. I learned a long time ago in sales when I'd have a room full of producers and I had a product that we just added on a new feature and I wanted to talk about that. And then I talked about, oh, and there's this and this and this, expecting everybody in the room to know these base things. And that was the best part of the talk, was those base things. And I've carried that through that, not that room full was not at that advanced level, but there's that base thing that I just busy doing all the things of my farm and ranch that I haven't picked up on that. And that took a shift in my brain that I'm not backing off what I talk. I'm talking to the people about what they'd like to hear about. And that shift of, because you don't want to be talking down and you think if I start there, I'm talking down, but you're not, you're just connecting. And so that's a good pull by you. And I back that up that I've seen that over time with, international trade conversations or things, or what is the WOA, and why do we even why the hell would we do that? Well, we export to a lot of countries, so we want one set of rules instead of a set of rules for every country. Does that make sense to you guys? Yeah, that makes sense to us. So this is how we go about that. Okay. Easy to skip over, easy to explain, but yeah, good catch.
I'm a farmer and a businessman from Montana, and I've been in Montana politics for close to 70 years now. And what you just said makes a lot of sense. I think the thing that I've seen in politics over the years is a big change from government is there to help you to a big distrust in government. I know that's in in the United States, and I can hardly think it isn't in Canada either, or any other place. And we've lost that common sense touch. And you touched on that. Don't talk down to people. Let's try to make the approach right, like Mike, you talked about. You just don't go in there like you're the sheriff and you say you're going to do this. And that's really hurt the relationship between government and people. And it's too bad. And I hope it changes. But that distrust in government is not a good and healthy thing for our free countries.
Any other comments or questions?
I love that question and that comment, because that's 100%. We need to bring it down to basics on a lot of these things. And I know, if I can say the T word again, the traceability conversation has been one of those. where those of us who are ingrained in FMD planning and, trade discussions and those things, we have had countless hours of background information to explain what this means and why we have to follow these rules and what the boundaries are on what we're allowed to do in different situations. And the average producer doesn't know those things, right? So bringing it down to that level, it is hard to do though, because, for as we're trying to provide people with enough information to understand, but not overwhelm, that is really, really tricky. Yeah, it's a very touchy thing. There was another comment I had that I'm losing, so, oh, yeah.
That's all right. If you think about it, I will come back.
I think one other piece that I've noticed on my end is the importance to really, really safeguard the trust our producers have in our national and provincial organizations. I think that the minute that deteriorates, then that's when things really go sideways, because then you've got a whole lot of producers that feel responsible immediately for their own security, their own futures, and they don't have the knowledge, and then they all panic. And so safeguarding that, whatever that takes. So I know that we talk a lot about the trust with government and CFIA, but I have seen those particular relationships also come under threat recently. And so it is across the board. And I think it's something that our organizations and agencies maybe haven't had to really think about tackling or having a strategy internally in order to maintain and continue to maintain that. And so I think we probably were really graced with a period of time where that was just a foregone conclusion. And now we might need to look at actually paying more attention to that need moving forward.
I think that's a great comment. I think we are close enough that we can about wrap up. Maybe the one thing that I will close with, and then we'll take a break. One of my experiences has been, and I wonder if it translates a little bit to the O word, is when you're talking to somebody in regards to avian influenza, when you're having a conversation with a small flock, like, a backyard hobby flock, or even somebody that has 200 birds or 300 birds that you have to depopulate, right, because of this detection, versus one of our layers that has a barn that has 75,000 birds in it. My talking points were zoonotic, the severity of the disease in the bird itself, and then trade. And they don't feel like they are part of the poultry industry. They're like, we're not poultry. We're not the poultry industry. We're not the layers and the broilers in, the Southeast United States. We're a family operation. And so I think sometimes making sure that our messaging tracks for them, even though all those talking points are solid, that third one, trade, is a really hard one, but it actually is the one that's driving the conversation. And so figuring out ways to bridge the gap with those small producers or some of those niche producers is really, really hard. Okay. Oh, she thought of her point, and then I'm gonna come over here and then we're gonna break.
I guess you actually reminded me of what I was going to say. It's about recognizing that all species are not even close to the same. And I feel like sometimes we deal with different regulatory agencies or other producer groups that we just operate so differently, and even in Canada versus US. And so there will be an assumption that what worked for avian influenza or what worked for swine flu or whatever will work in the beef industry, however that might be. And we are so different. Not everybody will recognize that right away. So
excellent. Okay, let's go over here for one more.
I'm just gonna go back to a couple of the comments about the ostriches and the trust. I think that we need to talk about it's trust from you guys that you have to gain from us again too, right? As producers, as industry, I think there was a lot of stuff that we put out there. It wasn't a perceived threat on some of our CFI employees. It was actual threats, just to be clear. I have an employee that I had to move out of his house for a total of a month because people showed up to gang rape his wife. I personally had to have RCMP at my kid's school for 2 weeks because pedophiles tried to show up at the school to take care of my kids because I was involved in that file. So if I'm going to make it personal, that right there shuts down where we want to put our face out there, where we want to put our name out there. I used to have no problem handing out my phone number to anybody. I would go to sites, I would go to producers, I would go on farm. I did everything I could to build those relationships, to make sure that I was at their level, to build that empathy, to show that we understood what they were going through, and it is not a fun time for them. But after those type of things, you have to back off. I have to look at my family, I have to look at my kids, I have to look at my coworkers and know that I can't send them out there doing that anymore. And the only way that that's going to happen again, Miles, if you join me when I go to a farm. So that's the thing now, like we need to build that. So if you want to build that trust with everybody, it's you saying, hey, I have so-and-so, come spend 2 days with me and drive around. I'm not going to be there to send you out as a sacrificial lamb. I'm going to be there as your partner, holding your hand, stepping in front of you when that producer decides that he's going to get mad at you and say, hold on, let's calm down. Let's listen. Let's have that conversation. Let's have a coffee and talk about what you need to talk about. Because to be frank, the people that started all of that stuff, traceability, the ostriches, were not producers. They had no skin in the game. They still do not. And they're the ones that are causing all the problems. So the only way that we're all going to get back to that table and we're all going to be able to work together again is if we do it together. And that means Miles, Glenn, everybody, we're all going to go out. We're going to go for a drive. And we're up for that. Noel's up for that. I'm up for that. Mandy would do it. We would all come out. You just send us the invite and we'll make it happen. But we need to know that you're there standing beside us and not sending us out as a sacrificial lamb, okay? Because I can tell you, we've been there. I've been the sacrificial lamb for the last year. I'm not impressed with the government of it, and I work for them, but I'm also not impressed with producers or people, to be frank, I grew up with. I grew up in the industry, the poultry industry. My kids go to school with most of those poultry producers' kids, and they stood back knowing what we were going through and did not say anything. And secretly, I would get text messages or emails to say, we're behind you. Got your back. Totally proud of you. We're all there. We know this needs to happen. I did not see, not from one person, an industry or province or other government departments publicly say that. And that was the problem. And it should have happened. End of the rant. That was not a question either.
You opened us up, so it makes sense for you to close us out.
I just wanted to offer a perspective because at Animal Health Canada, we work with both government and industry daily. And so for us, our vision on this might look a little bit different than what you guys deal with every day. But to me, the government and industry is part of a system. And so when we lose our relationships and our trust, we actually look like we're divided and we're no longer in a partnership. And to me, my day-to-day looks like this. We as industry are responsible to CFIA. CFIA is responsible to us, but those responsibilities just look a little bit different. CFIA saves industry from having to do a lot of dirty work. And I think that sometimes that gets looked at in a lens that isn't something that industry recognizes or feels like it has any influence in. And so then that's when that gap starts to build. Around our table, industry has a lot of influence in government and government has a lot of influence in industry. So I can tell you this relationship can be healthy and it can work very well, but that recognizing that dual responsibility to each other is necessary in order to have that happen. And so I apologize that you guys were left in the cold on that. We recognized it at the time. We did not know how to handle it. It's the first time we ran into it. And so we do recognize that that was really, really inappropriate. And in my personal opinion, which I'm not supposed to give because I'm paid to not have opinions anymore, I do feel like we failed in supporting the institution that we use to maintain and safeguard the health of our system. And that's a failing on everybody else. I don't think it was an intentional failing. I think it was a lack of understanding of what was needed. And so when it comes swing back to that lessons learned piece, I think that's a big one. That's something that we do need to consider and talk about as a group as to how we can do better next time, if there's a next time in that. Because I do consider that one a fail.
And let's be clear, there will be a next. There will be. There will be. That was the tip of the iceberg. That was like mission to the gate. And we did not, we as a collective did not stand up and shut them down. And so that will continue. Excellent. I think that's a really, I mean, it's a hard point, but I think it's a really strong one to end on. So let's take a 15-minute, let's see, we're 7 minutes over. Let's come back at 10,
It's like
10:50. And we'll close her out. Thank you, guys. Despite how well that conversation has gone this morning, how well the conversation has gone this morning, I think as planners, some of us in the planning sphere for cross-border livestock health have really struggled with what we do with these sessions and what we want to try and get out of them. From where it started, I guess from where I stepped into cross-border livestock health, I think 7 years ago, to where it is now has definitely changed. And so we've got a couple of slides, and do I control them? Oh, look at that. We're not going to do all of them. Stephanie graciously put these together, and then I'm not going to use them all, so I apologize. And I don't have glasses on, so this is going to be even better. When I first stepped in, how many of you have attended like a meeting pre-2020, pre-COVID? Penwar, a cross-border livestock health meeting. So there's a few of us that are in here. Back then, we used to have a much larger presence from USDA and CFIA in the room. And there was, at the end of each meeting, there would be like a series of tasks. So one of the big points of conversation back in 2019 was electronic documentation and how animals moved across the border. And so we would have these kind of to-dos, and then we would all go out into the world and work on those to-dos over the course of the year. And then come back the next year, report, and again, start that cycle over again. There was a lot of conversation about a cross-border response to disease, and I think some of the zoning conversations have really moved forward from those. And so we got to a place where we didn't feel like we had kind of tangible things that we wanted to affect change at the national level. I think additionally, with some of the I can speak best to my side of the border, obviously, but some of the changes that have happened at the national level through multiple administrations in the United States, it's harder to pull folks from USDA to this meeting. And so we've been in this kind of state of flux of like, where do we go next? And I think the cross-border piece maybe is the hard one. And I don't know that it's maybe, even despite the name, is the essential piece, especially considering the discussion that we had today. It isn't maybe so much about, what can we be doing the same or what policies do we need to change, although we just had a small conversation about that. But like what we would like to do. And while there's a planning committee, this is all of our group. And so if there's thoughts from the group about what you would like to see going forward, if there's additional content, if there's a different structure that we should be taking, we would love to have that feedback. I think especially in light of some of the conversations that we've had over the last day, I think there's some thoughts that we were just kind of triangulating here in the group is maybe trying to, I'm going to butcher names and titles, so I really apologize. But the gentleman that spoke at the back of the room about, when we engage with legislators or people that are in authority to change those regulations, like how do we advise them and how do we help them? And so maybe having a session next year to talk a little bit about tuberculosis is something that has been experienced north of the border and south of the border. Where are some of the challenges with how rules are written around tuberculosis response? What are some of the stumbling blocks that we encounter as the regulators that have to go out and enforce those regulations? And then how do those kind of stumbling blocks impact the producers, which is going to be, I think, the most meaningful feedback that we can provide. And so having a session that's a little bit curated towards a legislative crowd to try and help them. Continuing on with some of the really, I think, great and robust conversation that we had today, where it isn't so much about trying to affect some change at a national level in either of our respective countries, but really like how do we learn from the structures that we have or the experiences that we have to kind of strengthen both of our industries, because ultimately that still benefits everybody. So our thoughts from the group or comments on that, or Hussein, Stephanie, please jump in. I don't have the remote, so I need a... Miles, do you want to go first?
Can I go first?
No, I'm just kidding. Steal my microphone. Miles woke. He's done it twice, Steph. So this is just something that's sort of been circling in my world for the past few months. I would say maybe 3-4 years ago, animal health was really high on the docket at a political level. It was a really hot topic. People were pushing on ASF. There was a lot of discussion around preparedness. There was a lot of support around the table, a lot of drive from top down about that topic. And I think that what I'm seeing is a lot of shift towards the concepts of trade, resilience, competitiveness. And so I think a good topic for us to discuss as a group is how to solicit championship for animal health in a space where it seems to be declining a little bit. How to adapt our conversation to still move things forward where we might not have as much traction or support financially as we had in the past. How to make sure that we have alignment with everyone in the region as our goals, given the fact that some of our priorities might be shifting as countries. Things at that higher level, I think, are valuable conversations to have, and how we can adjust our expectations if we don't have as much buy-in or traction around the table on some topics as we've had in the past, and how to make sure that we shift our priorities accordingly.
I forgot what I was going to say from there to here. No, I would agree with that. And I think as you were making those comments, and this was something that Stephanie, maybe it was Stephanie said earlier, was like, is there anybody that isn't in the room with us today that we would like to have in the room with us? And so I'm going to ask a question of our industry folks from Canada. How many of you are from the like a national organization level? One. And how many of you are at the provincial level? So overwhelmingly provincial representation. I think from the US side, I think we've been better at getting our livestock producers in the room. I would say not to the level that you all have risen to. And the swine industry in the United States, we don't seem to get them at the table often. And you guys are a consistent presence here. And so I think from our side of the border, I think that's something that we can work on, is maybe trying to bring a few more of our state groups into the conversation for next year. That's something that we can go back and work on because they will help, I think, with some of those points and conversations. Questions or comments from someone else? Yes.
Yeah, just to follow up on that, we've got, pigs and cattle who trade more than some of our other industries too. So that is notable, but not unique. I do, come at it from a national viewpoint. I look at global trade and protectionism. And there was a time when protectionism was less of a thing on this continent, but we still aspire to export a lot. And I wonder if this is a forum that helps us figure out what we can work on together strategically as we try to approach exporting around the world. And those multi-country forums like WOA, like Codex, like where are the problem places, or how can we make sure they're working for us instead of being taken over by the EU is always my boogeyman because they get more votes than I think they deserve. But, that kind of thing. So I don't know if there's a working together to grow trade with an animal health lens that fits at this group?
You're well, would be well in well over my head in that conversation. I wonder if that's something that, Brandon from Penwar always talks about feedback coming back to them, if there's something that they can help with. I believe there used to be a separate tract that was just an agriculture group, right? And then cross-border livestock also happened. So there was 2 sessions between those two groups. And it seems like the ag session has gone away and is now as a panel discussion, but isn't truly a session. And so maybe cross-border livestock health and agriculture, or maybe cleave the two, and cross-border livestock health maybe doesn't have as long of sessions, and we bring back an ag component to do some of those trade conversations, because they certainly expand beyond animal health issues. Does anybody remember the ag session?
Yeah, so I remember, so I go back, there's probably others in the room that go back with Penwar further. My first time at Penwar, I think, was in 2016. And my remembrances of this pathway at that time is it was combined with the ag. And so we would bounce back and forth between general ag issues and cross-border livestock issues, and maybe not even as much health, because we were talking at that time, and of course some of those issues, they were the hot topics of the day, but certainly there's hot topics of today that we could of this time that we could come up with. But we were talking about border crossings, increasing efficiency of border crossings for livestock and ag products. Do we have enough border crossings? Does Canada and the U.S. need to be working towards more border crossings? I think now I've talked separately, and that's interesting because we haven't brought it up in here, but I've had lots of conversations this week about the Ridgeway Raymond Port in Northeast Montana from multiple people about a desired interest in Canada and the U.S., Montana and Saskatchewan, to make sure that border port stays open, to make sure that it still can receive livestock, and that's at risk. But we haven't talked about that in here. At that time we were talking about the hours of service regulations, right? So the U.S. was putting in hours of service regulations on truckers. How is that affecting Canadian haulers who are coming into the U.S. and the time they were getting stopped at the border? So those issues were. And I don't think it's wrong, but what I've seen happen is I've seen the content shrink down to more technical animal health response content versus general cross-border livestock issues, health being one, but there's certainly being a lot of things that didn't relate to health that were in that, and broader from not just the livestock expanse, but from ag as well. And that was, and I'll say that was different. The room was full. We had lots of USDA high-level leaders. We had more of our directors and ministers that were there. I think one of the challenges now is, like you heard on the stage this week, David Merritt and Derek Sanderson, who were on the panel with me, they made a choice to be here. They're not at the Western Association of State Directors of Agriculture, which all of the state directors of agriculture from the U.S. typically go to, and then most of the ministers for agriculture in the provinces go because they're working on these types of issues. So you have that competition that's going on for people's time. But I guess my suggestion would be is that when we had larger attendance, there was more of a sense of working on the emerging issues of the day, trying to create some sort of consensus or coalition between Canadians and Americans on both sides of what needed to happen, and then putting forward those recommendations to Penwar for Penwar to put in their bag to advocate for in our state and provincial capitals, to advocate for in Ottawa and DC, and then also commitment from the various organizations that were there. And we had a lot more, I would say at that time at that meeting, there were a lot more industry organizations represented when we had that content. And there was that commitment that we're all going to go home and advocate for these shared issues on each side of the border, do what we can in that respect. So I would just say that's going back to when there was an ag track, and what I've seen change in the last 10 years is I've seen it get much more technical and much more response related, which is great. It's a great conversation. It's great for all the veterinary animal health staff that are here, but I also think that becomes a bit of a detractor when you want legislators or others to be here, because they don't know how they fit in that conversation, or they don't understand that conversation when it gets so granular, so technical, or what it is you're asking them to do.
Which in our little intermediate triangulation, I think Cassidy hit on that, is that for that legislative piece, if there is that sprinkling of some of the technical so that they continue to get exposure, right? Do you want to expand on that?
I think for me, this is sort of a bit of Animal Health Canada's wheelhouse, where we move from that policy regulatory discussion down into technical, and it's a bit of a life cycle, actually. So you identify the issues at the policy regulatory level that need some support from the top down, and then it's natural for it to shift down into the technical space, because that's the execution. You start with the what and you move into the how, and then the what has to come back up again, because you need to start there and go back down. And so I wouldn't be discouraged personally by the fact that this has moved technical. I think the question then becomes, is it still in a technical space, or do you want to start trying to pull in some more of that what? And just recognize that I think that that's a pretty normal flow from what we experience when we sit around these tables and discuss animal health topics, but others might have opinions on that.
How many people in here right now, animal health is the majority of what you do, or animal health is the majority of what you do? Is that the most of us? It's about a 50-50 split. So I think that, I know that somebody has the microphone and wants to make a comment, but I think that even in Washington, when Washington co-chaired with Teresa in British Columbia, was it 2 full days of session, or was it? So I wonder if we could expand to maybe like a morning and afternoon and a morning, and then it's going to need somebody probably other than all of the veterinarians that are the co-chairs, but to help expand kind of back into that other space. Go ahead.
And sorry, Teresa. Yeah, I think we might be in a similar headspace, but I like what Mike said about and what you just said, Tahnee, about putting a bit more of a broader agricultural lens on some of these conversations, because a big piece of what we could work on cross-border is regulatory harmonization, right? So, we talk about border crossings, or we talk about, drug licensing, which fits into the animal health space, but we can talk about all sorts of those issues that cause us headaches when we're trying to work together in a livestock space. So I think that there could be lots of opportunity to talk about where we could each go back to our respective governments and advocate for some of those things that would make our producers more competitive on both sides of the border.
I like that. I'm seeing nodding heads.
I actually just had a question. So when Cassidy was talking about the what and the how, are those what conversations happening anywhere else for the Pacific Northwest region on an individual person-to-person basis, or at a forum or a table? And if not, why have they sort of died away? And if yes, where and how does that engage with PNWR?
Was that for me?
That was for people who might know the answer, which maybe might not be us veterinarians.
Thank you.
Hi, I'm not sure if this is the right place for this ask, but I'm an elected official from this side of here in Alberta. And I totally appreciate all the animal health people and all their concerns on having 2 full days. But for somebody like me that can actually do some advocacy, if you had even one session through the 2 days that can be just kind of high level. Like I am a beef producer too, so I actually understand some of this stuff. But if you had some of the high level stuff at one session, because I can't just sit in here for 2 days when I'm supposed to be on the other side as well. And so if you have one session that's about high level, what can we do as elected officials? So whether it be MLAs, legislators, councillor, like municipal elected officials, whoever, if you have one part that we can join in and you can give us a high level of the advocacies that are needed on both sides of the border, that would be so valuable for some of us.
Thank you.
Sorry, I'm going to put you on the spot here because this is something that's been a curiosity for me. Do you think the people around this table understand what you need from us in order to advocate for us?
Sure. To be honest, because this is the only session I've sat in, because I'm here on behalf of my community. I had to be on the other side to be able to, thank you. I had to be in some of those other sessions. And so I wasn't able to sit here. Last year and the year before, I sat in a few more of these because, like I say, I am a cattle producer, so I actually give a shit. But I couldn't do it this time because of what I had to be over there. But we need to have tools that we can take forward. We need to have like action plans or even just information, like basic information. Like I understand, but my colleagues don't because I'm the only cattle producer on my council. You understand because you're a cattle producer as well. And so we can work with our province to do this. But we can't sit in 2 days of meetings to get those little nuggets. So I'm not trying to negate what you guys are doing because you guys are phenomenal at what you do and you guys need to share that information, but we need just little bits so that we can do that advocacy.
No, that's really good feedback. Thank you.
I think that what we need to do when we get legislators in here is talk about the emergency preparedness. Like, we've talked about the vaccine banks, we've talked about things for foot and mouth and ASF, but it's the emergency preparedness that the municipalities in Alberta and Saskatchewan and the counties and in the states that need to have that knowledge so that we can bring it forward to the the feds and the CFIA and Animal Health Canada that we have these legislators that are in our corner, because right now they have no idea what the meetings are right here. Like Karen said, she's been at other sessions. There's very few legislators here, and that would be an amazing thing, is to have them in the room for that emergency preparedness conversation.
I think that would be good.
Yeah, thanks. I am a legislator and a cattle producer as well, and that's why I've been sitting through all 4 sessions, just because it's highly important to me. But to most of the other legislators that are here, they don't. This isn't their wheelhouse. It's my wheelhouse, but it's not their wheelhouse. And I think if we could do one session on emergency preparedness or something and really push it and try and get as many legislators here, because there's very few of us in this room, as many legislators to that event as possible, and push that one topic, and whether it, and I think emergency preparedness is a great topic to have, because that's not just at a provincial and state level, but it's also a municipal level. If you've got something that happens in your particular area, and you're going to have to deal with that. But I think that's an opportunity for everybody to give feedback to those legislators, and they can go back to their respective jurisdiction with that information. But it's tough because, as was said, I mean, there's a lot of other things going on right now, and a lot of other interesting topics and that's what this conference is about too, right?
Honestly, I think some of that comes back to even some of the troubles that we were talking about with communication, is that us animal health folk, we live in a very narrow lane, and we can talk about our lane all day and all night and at dinner, and other people don't want to talk about some of the things that we want to talk about. And so I think bringing our head up for fresh air maybe is a really good takeaway. So if we there's a planning committee that happens for this session, and there has been consistent. Darcy has been on it for multiple years now. folks from Alberta Beef have been on it. So I think if we can continue to kind of leverage maybe you folks on that planning committee to help us bring our head up for oxygen that legislators, that our representatives can utilize. I think that would really maybe match with the spirit of what Penwar is supposed to be, right? So I think that's an easy thing to look forward to. Stephanie, do you have a comment?
Well, I'm kind of going right where you were, because I think it comes back to Teresa's question of why have we gone here? And so this was my first experience on the planning committee for this group. And it really was us saying, well, so what the heck do we talk about? Because there was no feedback, there was no action plan, there was no governance around how do we do what we do. So we kind of just came up with something that made sense. So I am really happy with this feedback over how can we engage at the right time. And I think that's a great opportunity for us then to work more closely with the Penwar organizers in terms of what are those typical sessions that folks like yourself are going to be at, and how do we make sure we don't overlap with those spaces to as much as we can avoid that competition. But then that is kind of a process question, I think, for this group is, how do we best as a planning committee engage at the right time to know what is this emerging issue that you want to deal with? Because I mean, we can brainstorm today on topics 100%, which is great, but things are going to change by then, right? So right now there is no true process other than we try to have that people on the committee that can say, okay, I guess go back to your organizations and tell us, is there something more procedural process wise that we should think about to get that information? Cass.
Sorry, I hate this because I deal a lot with governance right now. We're setting up a bunch of different teams that do a lot of different things, and in terms of reference goes a long way. And I'm not saying you need one for this group, but understanding the scope of topics that this group wants to cover can go a long way to helping you guys narrow down as a planning group. And it seems like a small thing, but for me, what it does is you can just look down your list and say what issues are sitting in these topics right now, and it narrows down your playing field a little bit. But I do think pulling into that advocacy space should be something that's always consistently happening here. It doesn't always help to talk about issues and then not get traction from them at that higher level. You can do a lot with the people who are executing, but you do need top-down pressure almost always to get really large-scale traction on things. Those people who advocate at the legislative level, they remove barriers that the people sitting at the veterinary space cannot touch. And so having both pieces of that is essential to be, in my opinion, effective on something as large as a regional commitment.
Did you want to make a comment?
Yeah, I
yes,
did.
Please.
Sorry. I'm good. Okay. Hi. So I would highly encourage the veterinary organizations and your breeder associations to continue doing what you're doing. But just when you're working with that planning committee, just highlight one that the rest of the legislators and the elected officials and those can go to. Just kind of make it a focus with your overall Penwar planning committee and say, we need our electeds at this one.
Session.
And so just so that, but I highly encourage like that you guys keep your 2-day event and keep going through that technical stuff, because that's how you get that brainstorming. That's how you get those answers. But then the rest of us can come in and say, hey, this is what you learned in these days. And you guys can tell us, this is what you need to go talk to everybody else about. Just a thought.
I think we can do that. Does anybody want to venture an answer to Teresa's question? I keep thinking about it. And I think my short answer, Teresa, would be, I think that it's probably happening like in the United States, like NCBA probably is doing some of that. Like some of the national organizations are doing that within their wheelhouse. But I don't know that in this diverse of an audience, I can't think of an example of where it is happening.
So that there might still be a gap.
Yeah, I would agree. I think it was a good question. I had really struggled to.
What was the question again?
Hopefully Mike can repeat it or.
Yeah, what the question about is there another venue or another place where this conversation, the sharing is happening? Is that?
Well, and we talked a little bit about the why. We spent a lot of time on making sure that folks understand the why. And then Cassidy brought it up of like, sometimes you have to cycle back to the what itself. And so I think, Jeepers Creepers. The question was like, where else is this conversation
Right.
happening? What other groups are doing this?
And I think you're right on. I mean, it's happening within organizations, within producer groups, but again, that's all very siloed, right? So if it's cattle organizations, pork organizations, poultry organizations, they're siloed off from each other. They're having those conversations, but where's that conversation happening that bridges all of the species, all the commodities? And then I think the second piece that makes this unique is those conversations are happening siloed in the US and siloed in Canada. And I think where we have the unique opportunity is to bridge the gap across commodities and then bridge the gap across the border. That's what I think is the unique position that this meeting has the ability to have, right? And does serve. Because I know I don't talk to my Canadian counterparts all the time. I mostly at Penwar, mostly at this meeting. That's where I interact and that's where I build those relationships. And then when we do something stupid in Montana and Canadians call me and go, "What's going on down there?" Or my favorite thing is when somebody proposes MCOOL legislation at the state level and I get a call from my contacts at CCA or Alberta feeders, or different groups. And I go, "Don't worry about it. It's not going to pass. It's not even going to get a committee. You don't need to sweat it." It's, so that, but nowhere else would I build those connections with other people than here. So I think that's I think that's definitely the unique position that we have. As far as spending a lot of my time in advocacy, and I'm listening to the legislators who are here. I think where you lose it, I mean, if you're in the industry, you're going to care about how many miles we draw or kilometers we draw control zones and things like that. And we still need to have those conversations, but I do like where this is going, of a session that talks about the what and the why of animal health. Why does it need to be a priority in state budgets? Why does it need to be a priority in the federal budgets? What type of regulatory reciprocity and do we need to do to make that easier across the border? I think really understanding the regional context, because there is a international boundary there. But as I said on the panel of the day, I have a lot more in common with Alberta than I do with Florida. And so I care more about what's happening in Alberta and Florida. If something's going wrong in Florida, that's far away from me in my mind, even though it's in the same country. But I'm more worried, and Alberta's more worried about what we're doing. And so when I think about a recent conversation, and I'll bring this up, an example of what I think this meeting could do for legislators and other organizations about how you advocate, it's almost the messaging I had to give our governor about our screwworm executive or emergency order that Tahnee wrote up a couple of weeks ago, which is to go in and say, we're putting out this emergency order. And I could have talked about lots of details on screwworm, but where the conversation was, hey, if screwworm shows up in Montana, we'll probably lose market access to Canada. That'll cost the state $500 million to $1 billion. And the next words out of his mouth was, "What can I do to help?" Right? That was the quick thing. It made it very real what the consequence was. And so if we could get to that level of, we're doing all this planning and preparation and work, and we need funding and we need regulatory reform, and there's a lot of things we need, but we need to be quick to what is the consequence if we get it wrong or don't do it right. And that's what I think legislators and elected officials care about. And that's where they will put some money in the budget, actually take some action on regulatory reform, because now they understand what the real consequences are. I think it's sort of nebulous to legislators that aren't in the industry why it's even important and why they should be funding us to do emergency planning and funding tabletop exercises and funding travel for our staffs to go to these meetings and other meetings they go to game plan how we're going to deal with things and to keep sharpening the saw on how we respond to disease. But sorry for that long statement, but that's what if I was going to encapsulate what that session could be, that's what I'd want to get out of it, is everybody walking out of the room understanding why it's important, what the consequences are, and some idea of what we need them to do when they go back to their state and provincial capitals or go back to DC or Ottawa.
Go ahead. Can I? Will it? Okay. Just circling back to exactly what Teresa was asking, because I do think there is a gap here. So on a national level in Canada, we have a couple higher level engagement spaces. We have an emergency management board. We have an industry government leadership team, but that's a Canadian national focused entity. You guys don't have anything that I'm aware of that's just Penwar specific. And so when you're talking about issues that deal specifically with this region, I think that it's reasonable to bring core group of people at that higher level, that senior leadership level, to have a bit of a discussion about what's necessary. Otherwise, I think you're always going to get that skew that doesn't really focus on the specific needs of this entity. There's some challenges in ensuring that you do your value proposition so that it doesn't look like redundancy to those people around the table, because they're all very busy. But I do think that that is a gap that's highlighted here.
I'm going to just say I'm a little jealous because we're not part of Pinwar. And so maybe I don't mean to, get out pom-poms and do the cheerleading piece, but I think the very fact that you have this in place is a very big deal. I know three of the four state veterinarians south of me. South Dakota is relatively new. We've had some emails, haven't met him in person yet, but we've at least made the contact. I know on an ad hoc basis, I can pick up the phone and contact, like I said, at least three of them. I'm not afraid to contact the fourth one either and introduce myself on the phone. We have those relationships and I'm comfortable enough building them further, but they're all ad hoc. They're as needed. I levered those recently because of a vaccine trial I mentioned earlier that we're doing in Manitoba, and I got 4 great responses from my colleagues south of the border to say, please go ahead and please make sure you share every piece of information you could possibly share about that vaccine trial with us. But that, again, is all ad hoc. We've done some disposal work on an emergency planning piece. We've done some depopulation work with Minnesota. But again, project-based, ad hoc. So I'm saying to you all that the very fact that you're having these regular meetings is a really big deal, and it's quite valuable. If I were to make a plug to kind of be one of those items that you carry forward, and going over to our municipal folks, emergency management, and maybe you've done it before. Again, this is my first one. But emergency management is a really, really big deal. Doing the high level, like, hey, Alberta municipality, I don't know which one you are, I want to bury several tons of pork in your municipality if ASF hits because there's no market for it, right? We need to get on both sides of the border, we need to get those thought processes happening. And I think it's very valuable to do that. If you're dealing with a fire or a flood, how many helicopters do you have in your area? Because I never knew I was going to have to rent a helicopter to go looking for cattle that were floated downstream in northern Manitoba or middle Manitoba this past spring. But yeah, we had to go find a helicopter to go find cattle. So that type of discussion, like, not to get into those weeds. I mean, I'm using them as examples, but to have that broad thought processes happening at the municipal, state, and provincial level, and county level, very valuable.
Yeah, just got to wait, right? You know how to use the mic. You've used it as much as I have this week. No, I was going to say that's a great point, and that's where I say like that why, and I'll go back to the example I gave, and I didn't follow up with when I got our governor to the place of, okay, what can I do to help? This ties into our earlier conversation. I said, the only thing I need from you, Governor, is when people call and complain and try to tell you what we're doing that's hurting them, this is the consequence of it, and this is why we're doing it. so that when our Montana version of Miles Woke calls in to the governor's office, who's a big donor of the governor, and says, these guys are shutting me off from getting these horses from Texas I want, he's not calling me saying, hey, get Miles horses in here. What are you thinking about? At least there's a chance it's going to be, well, no, I've already talked to Department of Livestock about that. It's a much bigger issue. This is why they're doing what they're doing. And that's the answer they get from their office, as opposed to believing that, or having a misunderstanding or getting misinformation or malinformation about, what we were doing and why we did it and why we took our action. So we can also help ourselves on that front end of the conversation if we can get some elected officials and policy leaders in here and help them understand the why. It helps them better deal with their constituents when they come to them with the awful story of what the government overlords are doing to them.
This goes directly to the point that I think we're circling around, right? In that a media vacuum will be filled by something. So when the communications, when there's an issue or before there's an issue, or just general communications, if there's gaps, somebody will notice the gap and they'll fill it. And once they've done it, then you're fighting you're catching up, right? So as much as you possibly can, use every channel that you can to inform the why, to justify what it is. And people can handle tough news. People can handle not pleasant stuff if the why is explained in the justification. Then they can have a debate about it, and we can say do this or do that. But that media vacuum, whether it's traditional media, social media, whatever, if you're in front of it and you have a general openness about your communications, and even if it's hard news, then people can accept that. But you most definitely avoid the chasm of the gap, right? Because that chasm is hard to get out of.
Great. Elected officials can help because they're going to call to them and say, I want my soundbite. And so if we've got the answers, then we can fill it with accurate information.
Yeah, exactly. Having some semblance of the scope and what's going on helps us then to respond. Just like when I was a manager, I had people on incidents going on in the oil field. I always wanted to know what was going on, because to be blindsided in the morning with bad news that had happened something had happened the night before, whether it was an execution failure or on a job or something went wrong. Getting surprised in the morning when the customer calls first is far worse than getting the call at midnight from the staff saying, look, this is going on and this is what happened and this is what we're doing about it. You can at least respond to the customer from a point of knowledge, just like the example with the governor, right? The governor, whoever it is in the structure, right? The more information that they have, the better.
And if we manage to get a bunch of legislators captive in a room, I have 2 words: business continuity.
Could I just, Michael asked a question earlier about, is there another group or is there other organizations or a place where this is being discussed? And I just wondered, is there room for this to be like the Tri-National Agricultural Accord, like in September, on their list of things, just like here, trade issues, animal disease issues, agriculture in general. I get it that it's Mexico as well, but maybe some of those things that fall out of there from a bigger national kind of perspective on 3 countries, maybe those are some topics that play here regionally, but vice versa, like some things that come out of here on a regional basis could go back up into that tri-national as well too, because I think even Michael, your mention of screwworm, again, it covers off a disease issue or an issue that we have to deal with that's Mexico, US, but also Mexico, US, Canada, and things that we're trying to do. So there's those kinds of things that overlap as well too. So maybe it gives us an opportunity to feed up and down.
I don't know how, I'm not the person to make that happen, but I would agree with that. Got one over here and then I'll come back to you. This side of the room has been underrepresented.
Hi there. My name is Donna Moore. I'm with Alberta Agriculture, and I am the organizer for the Tri-National Accord. Yeah, it's in Calgary, September 28th to October 1st. And we have 3 bilateral sessions, which would be Canada-US, US-Mexico, and Canada-Mexico, and those would be closed. But we're having 3 trilateral sessions, and one is specifically focused on animal and plant health, disease, and preparedness. And then for the first time, we're also having an industry roundtable. It's a capstone session at the end of basically at the end of the conference. And right now we're looking for industry's input on to what we can talk about in that session. So we're, for the Canada-wide people in the room, we're having an industry advocacy call next week. And so we'll welcome your input on that as well. Or you can just speak to me about some of those thoughts as well.
Thank you. Thank you for joining us. Go ahead.
If we do go to one key session and really try and encourage legislators to attend, my suggestion would be, and this is from talking to colleagues through this and last year as well, keep it very high level and not technical, because some of the legislators walk in here and it gets technical and their eyes glaze over and you lose them right away. So keep it very high level, and I would suggest maybe kind of focus on why cross-border livestock health is important. Really push that so that they understand all of the ramifications of the health aspect on livestock, and because disease doesn't stop at the border. I mean, we can close the border, but that screwworm fly, for example, probably isn't flying much across the border, but it is further south, right? And so that is so important that we need to make sure that everybody understands why this topic is so important and needs to be looked at in a serious way.
We can limit the amount of time that veterinarians have the microphone in their hand during those sessions.
I would do one caveat to that. I would not say high level at all. I would say succinct. Some of the legislators don't gloss over, and the details matter. So keep it succinct, but we need to understand the issue, the first, second, and third order consequences, and the first, second, and third order contributors, but succinct, right? So that there's a logical connection between cause and effect and very, then we're informed, right? Then we can justify and we can go and look where we can intervene or where we have to advocate or what we have to do.
Thank you. Anyone else?
No, I just, I think one of the other things with regard to the legislators that's important is to know who the people are who should be speaking to the issues, because quite often as livestock producers, we're not necessarily that excited about the legislators. Like, I look around this room and there's a lot of really capable comments or communicators from within industry who are ready to speak to it, whether it's veterinarians or representatives. But it's important that the legislators understand who those people are and what the basic messages are. But I also, one of the things I wanted to say too, and maybe it's more of a pep rally than anything in terms of hearing, as Darcy did about the screwworm, there was a day when that wouldn't have mattered too much in Alberta, because most of the feeder cattle coming into Canada were tested for blue tongue and anaplasmosis, and that was a hot issue. I mean, I attended regional Penwar meetings in the late 90s trying to sort out what the issues were. And those were attended by state veterinarians and our provincial veterinarians and CFIA, because Canada has a national animal health status. So everything that happened in the West Coast also had to be approved in Ottawa. So there's been a lot of progress made, and it's been through the work that Penwar did and the relationships that have established. So I haven't been at a PENWAR meeting for quite a few years, but it's interesting to see the progress that's been made. And I just want to acknowledge that and encourage you to keep on the strong relationships, because that's how things happen. And it did happen eventually. I mean, in Canada, we had the seed stock industry totally opposed to anything new coming in. Well, today we heard feeder cattle are coming from Kentucky. Who would have thunk it, right? Like, there was a day when that was unimaginable, but you've made tremendous progress working together. And I just want to take my hat off to that and encourage that to continue. The fact that maybe the agenda isn't burning today is also a matter of success, but it will there'll be peaks and valleys when there are current issues, as there have been in between years, that are extremely important. So keep up the good work, I would say.
Absolutely. I was at a livestock market in Montana recently, and we send so many feeders north, right? And they were talking about they did a load of culled cows to go north. And then in asking around, I find out that that's starting to pick up. So there's another area, right, where our industries are there's communication and growth, so that we need to preserve.
Just circling back to that comment, the relationship building is necessary to maintain and keep consistent, because that's the insurance policy. But unless you're like a select handful of people in the insurance world, insurance policies aren't sexy. And so I think that we undervalue that in and of itself is 70 to 80% of the challenge, is maintaining that relationship. And so committing to just being and participating is actually, to me, far more important than the actual topics around the table.
Any other comments from the group? We are running out of time, and we are leaving here at noon. We're not spilling over this time.
I'll be good.
Miles.
No, I just happen to hold the microphone.
I would say that based upon some of the comments, I think we can all acknowledge that if I'm going to make an ask of you, and I realize that it's going to expire. What we want to talk about 9 months from now may look very different than what we want to talk about right now. But I think that everybody that's in this room should be able to get Hussein's or my or Stephanie's email. I would ask that you maybe think about one topic. So business continuity was already thrown out, emergency preparedness. Like, if there's one specific topic that you think is worthwhile to bring to this group, let's compile a now list. And then as we start the planning process next spring, we'll circle back around and re-ask that question and see what has maintained the list, because I think that bears weight. And then obviously that'll account for also new and emerging issues that we see over the next year. The next one is in Boise, Idaho. So relatively easy to get to, and hopefully a lot of you will join us.
What's up? If you're going Boise in summers, much hotter than.
Any other comments from the group? I will say that I think, was it Keith, Dr. Lehman, that brought this kind of concept forward for the session? I will say that I think it's probably just victim of circumstance. I'm very fortunate in Montana that I haven't encountered maybe some of the challenges that have been discussed here today, very real challenges. And so I think I had a hard time getting my mind around the concept of this agenda and what we wanted to cover. But where I am now versus where I was 4 weeks ago, I think it came out really, really well. So I would just say, I'm not the host, but appreciation for all of you guys for coming to the table and being willing to have the open conversation and say some of the hard things that aren't always easy to say in a public forum, but I think they're really important to be said. And I think that's how we kind of start the process of mending some of that trust and then doing better as we go forward. So if anybody else wants any other comments, Hussein, do you want to say anything to close us out?
Oh, just thank you.
We will be looking for emails with topics on them. Thank you guys very much. Safe travels home.